Today we're going to talk about the signs, more specifically the 4 signs that your body gives you that you might be close to a heart attack. Heart attack, of course, not necessarily, if you feel what I'm going to say here, you're going to have a heart attack, far from it. But if you have one of these 4 symptoms, you need to start thinking about a cardiologist. And some of them you don't have to think about, you don't have to do it straight away. And look, I'm not talking about clear signs here. Not that you're going to have a heart attack, no. I'm talking about the strong feeling in your chest that you're going to have a heart attack. These aren't signs that you may not even know are related to the next heart attack, but you can be sure of one thing: if you take a very clear look at what you're about to see today, it could save not only your life, but the lives of many people around you. The body before having a heart attack, the heart before having a heart attack. If you don't know what a heart attack is the death of the heart cells due to a lack of blood supply, some kind of obstruction in the arteries that supply the heart, called the coronary arteries. There is some kind of obstruction or narrowing. Blood doesn't reach that cell, and then the heart dies. And then the heart hurts. To make it clearer and more didactic, that I have to tell you here, the heart is an organ that is here in the middle of the mediastinum between the 2 lungs. Let's open the bladder, which is the nickname of this doll, right? Let's take it out. Do the surgery, take out the lung, right bladder lung. It's going to be the bladder's anesthesia. Take it easy. Anesthesia is more expensive, and here's the heart, right? Here's the bladder's heart. Let's take the heart out. I'm doing this just to show you what a coronary artery is. I've removed the lungs here. Here's the heart of the bladder. This is the heart, right? And these little holes are the coronary arteries. If one of these holes gets blocked, you'll have death in the surrounding cells, which is the heart attack, right? You certainly already know that if you smoke, if you're obese, if you're a stressed person, if you have high blood pressure, if you have high triglycerides, if you have diabetes, all these conditions are conditions that, if kept in a prolonged state, can lead you to have a greater chance of having a heart attack. But what I want you to understand is that these 4 symptoms that we're going to talk about here today, calm down and we'll talk about them. They're not just limited to the heart. They can appear in other parts of the body, and that's where the problem lies. Places in the body, and that's where the danger lies, because these people feel something in other places in the body and think it's not the heart. And for you to escape from a heart problem, the treatment has to be early. The heart is not like any other organ. It doesn't play around. But look, a month before the heart attack, you can already show some of these symptoms if you want to know. Then come on down here in the comments, subscribe to our channel, come and be part of this family of medicine, health, quality of life that never stops growing. If you are already subscribed, check the bell if it is activated. There are many people complaining that they do not receive notifications from YouTube. Do your part. Check if your bell is activated on the side, name subscribe, click on it, and don't forget to leave a like. It's so important for the growth of our channel so that we can reach 3 million subscribers and help a much larger number of people. Without further ado, the first sign that you may have a heart attack, a feeling of weakness. Don't believe that a feeling of weakness is always going to be a lack of vitamins. It can't be. It can be a lot of things. It can be hypothyroidism. It can be a lot of things. But it can also be a sign that the heart attack may be approaching. And look, this is one of the symptoms most often reported in my clinical practice by patients who have a heart attack. They come in a month, 2 months before, complaining, so weak, so tired, they can't walk. No, it's impossible. They can't walk. Not that it's impossible to walk, but it's a weakness in the muscles. If you've had a heart attack and you know someone who has, ask them if they've felt this. It can happen because the heart may already be working poorly, and the heart is the one that sends blood to all the organs, and soon you'll notice that there'll be less blood in the brain, causing mental fatigue. There'll be less blood in the muscles, causing weakness. Consequently, the muscles receive less oxygen and work less, or at their lowest performance. You will even see people who have had heart attacks and who have previously started to fall without sustaining themselves. Secondly, the sign that you may develop a heart problem. Heart attack is dizziness and excessive sweating. And this also happens due to the failure of blood circulation. People, the heart is irrigated. It is the center of everything. It is the engine. It is the pump that sends blood everywhere. It is very simple to understand that when we have less blood circulating in the body, or in a weaker way, our brain feels it, and there comes a lot of dizziness, lack of cerebral irrigation. And this feeling of dizziness can be accompanied by sweating this in different parts of the body. Third sign that you can develop a heart attack, and this is one of the strongest, is a pressure in the chest, Only that person who is in a heart attack can feel it. Going through stress, that person who has been disappointed in love, that person, then that feeling in their chest, that person who owes people a family, man, owing is one of the things that hurts my heart the most, because it's very easy to see people, it's very common to see people suffering from other causes, but an honest, decent family man seeing their children in need of food. I've seen this a lot as a doctor treating people on the sauce, so it hurts my heart to see a man crying because he can't afford medicine for his child, as I've seen several times. Anguish, the emotional issue. But look for a cardiologist to keep it at bay. I don't tell. Sometimes at the time I had a lot of emotional problems that I lived in the cardiology emergency room, so much so that I had a panic attack. It was a panic attack, it was mental, but I was a doctor. I'm a doctor, so for fear of your heart attack, I lived in the cardiology emergency room. I'd get a chest tightness, and there I'd get an electric test and usually take the medication for mental illness and leave calmly, but at least I'd leave calmly because I'd seen that there was nothing wrong with my heart at least, but the chest tightness is much more important, especially if you're in one of those risk groups I'm going to tell you about now. For example, people over 40, people with a history of risk, I've just mentioned, high blood pressure, obesity, high triglycerides, HDL, low good cholesterol, diabetes, people who have relatives with heart problems, mainly father, grandfather, grandmother, brother, the old smokers. I hope that if there are any smokers in this channel here, for the love of God, no, is it possible that you continue to smoke? Sedentary people who specialize in driving on the sofa and watching Netflix, people who consume an excess of bad fats, such as fried potatoes, such as fried foods, such as even fatty stuffed cookies, called drug users, and felt pressure in the chest. Do not delay to see the doctor, will not, especially if you are in this risk group. And look, this pressure in the chest can also happen in the arms, especially in the left arm. A pressure here in the mouth of the stomach up here, and also some pressure coming towards the teeth, towards the jaw. In this case, you have to be aware that it could even be an acute heart attack, the fourth sign that you could develop a heart attack. Developing a heart attack, shortness of breath and difficulty breathing. I've seen this a lot nowadays, elderly people with shortness of breath, and then they go to the emergency room and they're nebulized. My grandmother was like this when I was still a medical student when I heard about it. So it's that old lady with shortness of breath who is treated for asthma with nebulization and goes to hospital twice. Dies of a heart attack, because we have to think that shortness of breath can be a pre-infarction. That term doesn't exist, but it could be that you're preparing yourself for a heart attack just because the lungs also feel the impact of the lack of circulation and the heart and the lungs. People, that's the sticky thing. That's the one. Like in Sierra, it's all together, heart and lung. Make an incredible team. But if you harm one, the other suffers a lot because they go very closely together. And you've seen here in the bladder, the lung stays right here. The lung is here. So the heart is very close here. The heart and lung here. Lung and heart are all very close. You are all very close together. So one suffers similar irrigations. The vessels that enter and leave the heart and lung. So all these vessels here circulate between the heart and lung. So they are very closely linked. But tell me, did you write it down? But tell me, did you write down all these signs that your body can give you a month before you can develop a heart attack if you didn't write it down? It's now a feeling of weakness. 2, dizziness and excessive sweating. 3, pressure in the chest. 4, shortness of breath and difficulty breathing. It's more or less the same. I want to know. About the same thing, I want to know if you're feeling any of these 4 symptoms. If you are, write them down. If you are, go to a cardiologist. Don't get worried or stressed that you're going to have a heart attack. No, these symptoms can be from various other illnesses, okay? It can be from a lot of things. Shortness of breath can be asthma, can be allergies, can be, so go to a cardiologist. It could be allergies, then go to the cardiologist, especially if you're over 30, and if you haven't already got our intermittent fasting ebook. The link is in the video description. Big hug live, healthy live, with passion, with God in your heart. Share this video with all your WhatsApp groups. Kiss you guys goodbye.